A bunion is when you get a deformity of a joint that connects a big toe to the foot and it starts bending in towards the other toes. You can find more details in the description part of this video with a link to the NHS website. I should say first of all that there's no evidence that exercises prevent the bunions becoming from any worse, but they may help with some aspect through stretches and strengthening of the bunion getting any worse. So you just saw toe curls. You can also use toe spreading as well, which you can do yourself, or use a toe spacer and curl your toes up and down, or you can just use cotton wool as shown between a couple or a few of the toes. Another exercise which can provide ease of strengthening and stretching around the area is the towel grip and pull. So just positioning something on the floor and either just gripping it or pulling and lifting it with your toes as you curl them up. Something that can help the muscles relax underneath the foot as well is a massage with a ball underneath the foot, and if the muscles are really tight, this can help prevent any further pull on the big toe as well. So you can either do this with a Pilates spiky ball as shown on the left or a normal hard ball as shown on the right. Another exercise you can do is toe stretch or abduction with an elastic band, and this may be quite painful, so you need to be careful with this exercise, but as shown, just position it closer down towards your foot or further up towards the nail and pull outwards repeatedly. Heel raises can also help, and as it says, just toes on the floor and raise your heels up repetitively. Also, taping for the bunions can sometimes help alongside stretching, and what you need to do is just position a strip of sports tape as shown and slowly pull it down the medial side of your foot. It can help if you hold the toe outwards while pulling the tape back, and then it tends to fix in this position slightly more. To reinforce this, you usually want to use 2 or 3 strips of tape, and you can leave the tape on for 24 hours a day. It may get a bit wet when you shower, but a lot of patients can find this quite relieving, especially with fixing the toe in a different position. As I said earlier, sometimes these things don't work, but we would usually try conservative management first if the patient wants that, of course. If not, other options for treating bunions are with steroid injections or eventually surgery. And these stretches and exercises tend to be used in the earlier stages when you're noticing your toes slightly to go inwards, rather at the latest stages when you'd be referred onwards for further advice. The last thing really, just to help around the big toe joint, is just passive stretches. So stretching it down, stretching it up and in and out, just to provide some stretch to the ligaments and tendons around the joint.